Welcome to the D&D Fitness Radio podcast, brought to you by your hosts, Don Saladino from New York City and Derek Hansen from Vancouver, Canada.
Good stuff. Good stuff. Well, listen, thanks for being on. And I think how I wanted to, Derek and I wanted to talk about was, Derek, how old are you now? Derek's in his 50s. I'm in my mid 40s. We're starting to think about things a little bit differently now with our skincare, right? Like I'm looking in the mirror now and I'm like, all right, I'm getting wrinkles here, right? It's not, listen, do we have this vanity component? Sure. But I think for people who take care of themselves, you want to do the best you can. You want to do those things that that are going to give you the best possible opportunity to live a high quality of life and feel great, right? And I think we feel like we're doing that nutritionally, and we feel like we're doing that from a training standpoint. But skincare is something that I think is so overlooked. Like there's certain things we need to be getting checked as we're getting older, maintenance protocols, maybe moles on our body, et cetera. And then there's a lot of misconceptions on what, we have our routines for our workouts and our nutrition,
Sure.
But a lot of us don't have our skincare routine. So I think I kind of want to like dive right into it and, just start talking about, first off, you and I got connected years ago, and obviously you're incredible at what you do, and you've helped me out drastically. But even now, after the pandemic, I'm like, all right, what do I need to be doing differently than 3-4 years ago? How has things evolved? So, Dr. Gary, take it away.
So, there's a funny meme I saw once that I think is perfect for this transition. And it was this, and it's totally a stereotype, but basically it's a man and a woman speaking, and the woman has like a list of 20 things that she uses to wash her face and, clean it and for maintenance. And the guy says, I wash my face with shampoo. And I think most men, unless you're educated or you're looking into it, that's what ends up happening. But in reality, all of us need to have some sort of a routine. One of the things that's really important is to make sure that the routine is simple enough that people are actually going to use it, right? That's where I think a lot of people get in trouble. You give somebody a routine and it's like 10 different things. And by the time they get home, they forget what they're supposed to use, when, how, and they just don't do anything at all. Okay. So I think especially for patients that have never had a routine, it's very important to keep it simple. So you really only need like 4 things, 4 skincare products, get you there like 99%. You need a cleanser, right? You want to wash your face morning and night. In the morning, because you're sleeping, you're sweating, your head's against the pillow. You want to wash all that dirt off. You want to wash your face in the morning. Then you want to apply a moisturizer with a sunscreen. Every morning, I don't care if it's winter, it's summer, a moisturizer with sunscreen every day. Because we know that not only do you get skin damage from sun, you're also getting skin damage from all of your devices, right? That blue light. I know you wear the glasses to protect your eyes, but you also need a sunscreen to protect your skin. It'll cause wrinkles and pigmentation. So I'm sorry
to interrupt. I didn't realize that about blue light. I didn't realize that can damage your skin as well.
Yeah, it's next to the same spectrum as UV that you get from sun. So a tinted moisturizer or sunscreen will actually help to protect your skin from your TV, your phone, your iPad, whatever it is that you're using every day, probably all day, right? Because most of us are on a computer all day long. So morning, wash your face, put on moisturizer with sunscreen, done. In the evening, you want to wash your face again because you're exposed to pollutants, you're sweating, whatever it is, dirt. You want to wash your face. You want to put on a retinol because that's going to be anti-aging. It helps to prevent fine wrinkles and lines. It helps your skin to turn over in a more healthy way. So retinol is a must. And then you put on a moisturizer. So it's a very, very simple routine. And I think most people can do it, 4 to 5 products, whatever you choose to use. And that gets you there like 99%. Everything else, it's kind of like fluff. It's like when you go buy a new car, they offer you the tire protection, the underbody protection, the paint protection. It's fluff. So, all the evidence points to cleaning your skin, using sunscreen, using a moisturizer, and using retinol. Retinol by far is the most scientific evidence for anti-aging and improving your skin. And I think that kind of a routine gets you there 99%. And, I think most people can follow it. Just put it in your bathroom, in your shower, whatever it is. and you just use it. And I think that's really great anti-aging, but also, also just, good skin hygiene and skin maintenance.
So just to reiterate what you went through for our followers, you said you're gonna start every morning with your cleanser when you wake up, even if you shower in the evening, because dirt, the pillow, your skin's gonna pick up those particles, and then immediately moisturizer with sunscreen. Then you're gonna wash your face. I mean, with me, I mean, listen, I'll train later on, so I end up washing my face after that, and I wash before
Anyway.
bed, right? And then, but in the evening, or let's say you're only washing your face twice a day. You're then going to wash your face again, maybe after you shower in the evening. Apply that retinol, whatever it is, retinol
It's a cream.
Cream, and then you're going to apply a different moisturizer without sunscreen. Correct?
Correct. That's it.
And then that's your protocol. Simple.
That's your
Simple.
protocol. Keep it simple.
Can you wash, like, if I'm someone who's washing his face 3 times a day because of training, is that too much?
No, it depends on your skin type, right? And you could have different cleansers. You could have a cleanser that's going to get rid of bacteria, like after your training. And you could have a gentle cleanser that you could use in the morning after you wake up. So that does complicate things. And, different people have different skin types. Somebody may have dry skin, they may have predisposition for eczema or psoriasis, and somebody may have really oily skin. So for them, washing their skin an extra 1 or 2 times per day doesn't really dry them out. And then majority of people have combination skin, which gets a little bit, tricky, but you can sort of play around with it and find the cleanser that works for you. It's sort of like a fitness routine. Not every routine is going to be for every one of your clients, right? So you want to sort of tailor it to them. And in the same way, when I see somebody in my office, we tailor their skincare sort of to their skin type. But you can still keep it pretty simple. That's the idea.
Derek?
Gary, obviously when Don gives out fitness advice, people are looking at his physique and going like, okay, yeah, this guy's credible. Do people come and look at your skin and go,
all the
okay.
time?
You have great skin. You have great skin. It's amazing. No one knows that. No one knows that you're 90 years old. It's incredible.
Exactly.
You're no one knows. I mean, you look 30. It's amazing.
If that.
That's exactly right. Listen, you're exactly right. It's part of the routine, but a lot of it is genetics, right? And it's the same in fitness. You have 2 people with different genetics doing the same thing. One's going to get jacked, the other person's just going to look like a regular person. So I think part of it is genetics, but part of it is, really taking good care of the skin.
And what is the science behind the retinol, if you could tell people?
Sure. So what retinol does is a couple things. It's an antioxidant, so it does help with sort of oxidative stress, which is, cells becoming abnormal, your skin turning sort of pigmented, so having those sunspots. The way I explain it to patients is it helps your skin to turn over, right? Our skin is constantly growing, this is the area of the skin, it's growing from the bottom up, and it's constantly shedding, right? It's turning over. What retinol does is it helps the skin to turn over in a more organized fashion. So instead of having old sort of damaged skin built up on the surface, you're allowing it to turn over. So you have what I call baby skin growing from the bottom up. And it does take about a month for you to see the results, because it takes about a month for the skin to turn itself over. So from that perspective, there's data on that. And there's actually some data showing that it may help with some sun damaged cells that may be sort of on a way to becoming abnormal or even cancerous. The retinol and vitamin A topical cream can help with. So it's the most scientific evidence that we have for using a topical cream, for that purpose. Nice. So it's a great product.
So that protocol you just gave us, that's more for a male. How would you adapt for a female, or is it the same thing?
Same thing. It's simple. Women sometimes, because of using makeup and other products, may add something else like a makeup remover or a toner. But it still gets you there 99%. I really believe in simplicity of things. I think you got to go back to the basics, because I see patients all the time. They bring in a bag of stuff that they've used, and it's like 20 things. And you start looking at them, and a lot of them are doing the same thing or claiming to do the same thing. You got to go back to the basics. And once you get there, you can maybe layer something on top if you want to, take it to the next level. But I think that gets you there most of the time. Now, if you look at skincare lines that are available in a pharmacy or department stores, for men or women, it's virtually the same product. It's going to have different packaging, right? So you're going to go for something, and I'm being stereotypical again, that's maybe like purple or navy. And for women, it may be like a softer color, right? Just same product, same company, maybe different scent to it, right? Because, it seems like there's maybe some differences in the smell of the product, but essentially the basics of that product are going to be very, very similar.
Now, quick question about products since you went there. There are a lot of different products on the shelves, and I know you happen to have my favorite products that I use. I'm actually out. I'm going to put another order in because I gotta reset my whole protocol here. But how does that differ from the products we see on the shelf? Are the products we see on the shelf, are any of them good? Is this something that, can you get away with that? Some of that stuff, like I know for years I used Cetaphil Gentle Cleanser. Like, is that at all good? Like, what's your opinion on what's on the shelves?
100%. You can go to a drugstore and get really good skincare products without spending a ton of money. I think that's really important. Now, I think part of it is sort of the cosmetic feeling that people get when they use a product. So, if you take a $40 eye cream and a $400 eye cream, the company that makes the $400 eye cream is going to tell you that it's much better, right? That's why they're charging 10x. If you do a study, you put one on one side and the other on the other side, you're probably not going to see a big difference. The question is, how is it going to make you feel to use one product versus another? It's the same as anything else in life, right? It's wearing $50 sneakers and $500 sneakers. They're probably, the basics are the same. It's just how you feel while you're, what's your experience like? But I think if you go to a drugstore and you use a trusted brand, the one you mentioned, Cetaphil, CeraVe, Neutrogena, Aveeno, and I have no conflicts with any of them. But anything that you're going to get in the drugstore that's a trusted brand, it may be the right product for you. It may not be the right product for you. Maybe you go for something that's higher, higher price point, like La Roche-Posay, which is still fairly affordable. It's every drugstore. So I think it's one of those things you really got to try it and pay attention and see what's best for you, and then just kind of stick to it. And and once you find the product that you like using and makes your skin feel good and you feel like it's doing a good job for you, you just kind of stick with it.
Gary, you talk about sunscreens, and that's one area that gives me a lot of anxiety about like buying the right product. What does SPF actually mean? Like, is a 60 better than a 45? Why do they even sell a 20? Right? Like, it's a little odd to me, like why there's all these selections when I just want the best one and I don't know which one to pick.
It's a great question, and it's becoming even more confusing because you're reading so much information. Like, this sunscreen may have something that causes cancer, or this sunscreen, if people who use sunscreen get actually more skin cancer. So, I think it is very confusing sometimes. Again, go back to the basics. That's what I tell my patients. There are a few things that are really important. For example, sprays do not work as well as a cream or a lotion, 100%. Okay. So I see this all the time. You go on a beach vacation or you're at the pool, somebody's just, they're spritzing the spray all over. They're kind of walking through it. It's like a car wash. And then they go and lay out for half an hour at noon and wonder why they get a sunburn, right? Because it didn't do anything for you. So sprays, if you're going to use a spray, like, it's great for kids because they're kind of, they tend to be squirmy and, it's hard for them to stay still. You still have to spray and rub it in. So if you're going to rub it in, you might as well use a cream or a lotion. Okay, so that's really important. As far as SPF, higher SPF does seem to give you more protection. Now, the FDA has, sort of thinking about rebranding or allowing certain numbers to be put on each package. Whatever it is, the higher number for sure gives you more protection. And in a perfect scenario, if you're in a lab, SPF 100, for example, you get zero sun damage. But no one uses sunscreen the way it gets tested in the lab, right? You may not be putting on enough. You may miss an area. You may be sweating, so it may not absorb into your skin. You're supposed to apply it a half an hour before sun exposure. Who does that? Well, I do. I make my kids do it, but most people, they go to the beach or the pool and then they start putting it on. Well, for half an hour, you're not really getting that protection factor. So higher numbers do seem to work better. And then it's just about trusted brands. What brands are trusted brands? And, I tend to use trusted brands. And then I tend to buy the product that has, a decent price per ounce. Because we know what happens. You can have the same package, right? Same size tube. And one's going to have this much sunscreen and the other one's going to have this much. So you got to look how much is in there and what the price per ounce is.
Hmm.
And that's basically how I choose it. Cream or lotion, the highest SPF possible, trusted brand, boom, you're done. And then it's about applying enough and reapplying every few hours. For example, when sunscreen gets tested, it says water resistant, right? You've seen this waterproof, water resistant. So what they do is they take this thing that looks like, basically acts like skin, they put sunscreen on it, they dunk it in a body of water, they take it out, and then they expose it to the sun. Well, most people, when they come out of the pool or the ocean, they're going to towel off. So that toweling off process, you just wiped off all the sunscreen that you had on. So you really have to keep reapplying it. And the most important thing is there's nothing better than wearing a swim shirt and a hat. Sunscreen is great, but you're better off having that physical blocker. So like I have 3 little kids, they all wear a swim shirt, usually long sleeves, they're wearing a hat, and everything else we're covering with sunscreen, just trying to do the best that you can.
What
Now,
about, I'm sorry, Derek, go
yeah, sorry. I was just going
go.
to say, like you said, trusted brands. Are you willing to name some? And even if you are benefiting from it, I don't care. I just want to know what you're using. And
Sure.
because obviously, you're not going to support a brand that you don't have full confidence in.
Yeah, I mean, so we use products like Neutrogena, Aveeno, Blue Lizard, Copper Tone. When you go to your drugstore, your department store, those are the brands that you're going to see in the aisle. Now, I tend not to use the drugstore brands because I don't know what the rigor of testing the products are, but they're probably okay, right? And then every year, Consumer Reports will come out with a list of their best sunscreens, and you could look at that as well. Like I love La Roche-Posay sunscreen, but it's expensive, right? So I'm not putting that all over, all over, because price per ounce, I may just use it on my face. My wife, who's also a dermatologist, loves Elta MD. That's her sunscreen of choice for her face. It's just, they're both good brands. It's just a personal preference. So what I would suggest, and this is what I tell my patients, is unless you're using a specialized sunscreen, when you go to a beach vacation, just pay attention to how that sunscreen makes your skin feel. Is it too greasy? Are you gonna get acne? Does your skin feel sensitive afterwards? Not every sunscreen is for every patient. There's a brand, for example, called Vanny Cream. Okay, they make great products for patients with sensitive skin because it's minimal ingredients. They don't feel like a really luxury product, but they're not supposed to, because if you have dermatitis, you want something that's just going to protect you. So I think, maybe getting some samples or little tubes and trying them and finding out what works for you, as long as it's one of those trusted brands, I think that's all fine.
What
Awesome.
about in reference to tanning and spray tanning, right? Like it's, um, I mean, are there any statistics um, on either of them, whether that's, completely detrimental to your skin? I mean, obviously, I would assume that regular tanning in a bed or a stand-up is worse, but are they going about making this any safer? Is there ways they can are starting to protect through technology? Are the spray tans the route to go, or are you being sprayed down with chemicals when in the long run that's not? Like, what's your opinion on all that? Or is there any science that can back,
So
your statement?
there's a lot of evidence to show that tanning beds cause cancer, 100%. And if you look at just melanoma, which is one that people hear about because it can spread and you can die from it. If you look at melanoma, there's a direct correlation between using a tanning salon and having melanoma. So we're finding it in younger and younger patients. And a lot of people go into it and they don't have any clothes on. So we're finding spots in areas where we normally wouldn't find them before. We're also seeing a shift in the age of patients who are getting melanoma and other skin cancers towards younger and younger patients. So when I started in dermatology in 2003, it was unusual to see a basal or a squamous cell skin cancer in a 30-year-old. Now I see it all the time, especially if they're using tanning beds. As far as spray tans go, you're basically just dyeing the superficial area of your skin, right? So the spray, it's just a dye. It's a skin dye. That dyes the superficial layer of your skin. As your skin sloughs off, it sloughs off with you. Now, you can be allergic to the chemical that they're using, but it's rare. I've only seen it a handful of times. Now, in the summer, I'll use a tinted sunscreen, or maybe something that has a self tanner, just to give a little bit of color, just to get a little bit of a shine. And I think that's completely safe, and it's definitely safer than going out and getting a tan. The reason people tan, this is very interesting, is it's the same addictive behavior as like drinking alcohol. So when you get exposed to the sun, it makes you feel good. You get these sort of hormonal, almost like a high. And when you don't tan, you actually feel down and depressed. That's why a lot of people have, seasonal depression, because they're not getting enough UV. Now, the flip side of the argument is vitamin D, right? This is always a debate. Like, can you get a little bit of sun to make a little bit of vitamin D? So as far as vitamin D goes, so you can supplement. That's really probably the safest way to do it. Or what you can do is get some sun very early in the morning for 15 minutes, or very late in the afternoon. So that takes that debate kind of, out. And one of the tricks with vitamin D is that you want to use something. You want to take your vitamin D with some fish oil, because it's a fat soluble vitamin. So if you're just taking it without anything on an empty stomach, it's unlikely to get absorbed. So I actually have a vitamin line. We put vitamin D along with omega-3 fatty acids. So you're kind of getting, both are good for you, and it helps to absorb vitamin D.
I've seen that. That's actually getting more and more common now with a lot of these fish oil supplements, fish oil and vitamin D. And I didn't realize that was the reason why. What about skin testing? Like, so we're all aging. What's the protocol? How often should we be coming in to see you to get tested?
Sure. So the recommendation is everyone over the age of 18 should get a skin cancer screening once a year.
What's that mean?
Okay.
Like a skin cancer screen? Is that just your eyes?
Yeah, well, so there's some technology, but essentially it starts with your dermatologist kind of looking at your spots. And you have to make sure that your dermatologist looks from top of your head to the bottom of your feet, literally everywhere, right? So they have to look at every inch of the skin. And then if anything looks abnormal, you can use a device called a dermatoscope. It's like a magnifier, for lack of a better term, but essentially accentuates certain features of a spot that may be abnormal. And then there are actually some technologies that we use in the office that use some artificial intelligence to tell if a spot is more likely to be cancer or less likely to be cancer. If a spot looks abnormal, usually what happens is we biopsy it, we send it off to the lab, and it gets tested. And then a week or two later, you get a result basically saying, is a spot okay or not okay? And if it's not okay, you remove it, and then you're done if it's something early. But essentially, everyone should go through that exercise once a year. It's kind of like going to your doctor, checking your cholesterol. You guys are the age where you need to get your prostate checked, all of those things. So it's part of that good sort of, health maintenance and skin maintenance.
Hmm.
Yeah, a lot of people obviously are, depending on where they live, are wearing masks. And do people come and see you and say like, "Hey, I'm wearing this mask and I'm getting, this acne," and like, has that been a problem in the last couple of years?
100%, 100%. And there's not a whole lot you can do, right? Especially if you're in a job. Like I wear what's called an N95, the mask that like literally filters almost 100% of all the air. And, after the day of work, I have an indent basically where the mask is attached to my skin, which is how it's supposed to be. It's supposed to be super tight because you don't want any airflow, back and forth. But definitely maskne is a big problem. But again, a lot of it has to do with hygiene and your routine, right? A lot of people will use the same mask for a long time. Well, a lot of these masks were intended to be single use, right? You use it, you put it on, you see, it's for medical, right? You see a patient, you throw it out and get a new one. So I think making sure your mask is clean, making sure you clean your face, you wash your face, all of these things are important. And then there is some medication that you can take also to kind of help with the acne from the mask. And that's usually just creams that help, and the skincare, and then sometimes prescription as well.
What about getting into, we haven't spoken much about exfoliating yet.
So, part of the cleanser, it could be exfoliating, right? So I like to use a cleanser that has a little bit of what's called salicylic acid, which helps your skin with that turnover. And then the retinol will help to kind of get your skin in a healthy turnover way. So it will exfoliate in the normal fashion. Personally, I don't love the idea of scrubbing, scrubs or some kind of a mechanical device that takes the dead skin off. I'd rather do it in a gentle way with a skincare routine. That's my personal bias.
Are you referring to like microdermabrasion?
Yeah, so microdermabrasion is a procedure that you could have, and I know a lot of estheticians use it to kind of, they call it clean your pores. But
Hmm.
if you have a good routine, your pores should really be clean anyway. Now there are some patients that have enlarged pores, and I think usually, in my hands, laser works the best for that. So it's a procedure you would come in and have done. I love using this device called Laser Genesis. I use it every day, multiple times per day. And again, it's able to shrink pores, get your skin to recycle itself in a better way, and then just help your skin get that kind of healthy shine that sometimes you see from patients. It's a great device to use before an event or before a photo shoot or a movie premiere, whatever it is. It just gives your skin that nice shine to it. So there are different ways that you can do it, but I don't love the idea of my patients like using an exfoliator or a scrub at home, because sometimes they get too aggressive and you get into this cycle of inflammation. And then once you have inflammation, it's very hard to turn it off.
Hmm, interesting.
Do you,
And it's
Garrett,
just
do you
my personal bias.
do some people just love getting that loofah in there and scrubbing the heck out of themselves. Um, do you do any sort of nutritional counseling, or do you refer for that to help with skincare in terms of things like supplementation? Like I've been taking some collagen supplements more for my joints and things, but is there something like that that is useful?
Sure. So I do nutritional counseling all day in my office, and it's mostly for patients that have inflammatory skin diseases, right? So if they have inflammation in their skin, whether it's acne or rosacea or psoriasis or eczema, there's some sort of an inflammatory process. And I think I'm in a minority of doctors that think this way, but I think diet is 100% related to that. Okay. So just before we got on this podcast, I had a patient who, we're doing some stuff for his hair, and we're doing some beauty stuff for him, and he also has some eczema. So I told him to essentially cut out white flour, white sugar, and dairy, because I want his body to not be in this pro-inflammatory state. Sometimes I work with a nutritionist, but usually, again, basics like, trying to eat whatever clean is anymore, because there's so many different ideas. But eating food that's natural and less packaged, less refined sugar, less alcohol that has, mixes in it, anything that lowers the glycemic index. For me, it's just part of like normal, health maintenance. I love the idea of putting people in probiotics. I recommend probiotics routinely. And I recommend, drinking things like kombucha just to replace that good, gut bacteria. And I think that all of those things are good health, health maintenance. And then, in New York City, I don't see a lot of it, but I have some patients that are overweight. And especially you guys probably see this all the time. It's men with that central obesity, which is all diet related. So we talk about sort of nutrition, and I like sort of, telling patients that your food should have like multiple colors. It shouldn't all be like bland, gray and beige and brown, sort of like a fast food restaurant meal. It should have, you should have salad, fish, fruits, vegetables, things like that. And portion control. I think we can all, eat just a little bit less, just to make sure that, in US, portions tend to be enormous, as you guys know. You go to a chain restaurant, there's enough food in, one plate to feed a family, probably, if you look at the caloric
Sure.
value. And
Sure.
to me, it's just part, it's part of good healthcare and good health maintenance.
Yeah, it's fascinating to me how, macronutrients are so, um, they're so closely paid attention to in fitness, and there's less talk about micronutrients, right? Like how it's a term I always like to use, is like how powerful is our food. And I'll see this especially with bodybuilders. They'll be eating this food that, yes, it's giving them the protein, carbs, or fats, but there's no life to it. And have you noticed that? Have you noticed with an improvement? Because I've spoken to dermatologists in the past who are like, oh, it's got nothing to do with your nutrition. And I know I'm not a doctor, but I'm like, wait a second, but it does, doesn't it? Like that to me seems um, contradictory to what I hear a lot of doctors like yourself talking about.
Yeah, I think totally eating as well as you can is very important. And simple things like, eating less prepackaged food and more fresh food. I mean, it seems very simple, right? And it seems like it would make sense, but a lot of people don't do it. I hear a lot of my colleagues tell patients that drinking water doesn't hydrate your skin. Well, okay, if you're drinking so much water that you don't need any more, yes, it won't get any more hydrated. But if you're not drinking any water and you're dehydrated, guess what's going to happen to your skin? It's going to be dehydrated.
Right.
It's just, I think in our society in general, we tend to just go to these extremes, and it's just about having a balance, right? You got to drink enough water, you got to eat fruits, you got to eat vegetables, whole grains, clean protein, fish, lean meat. And I think if you do that, less sugar, and if you do that, I think it's gonna your skin's gonna be in better shape and your health is going to be in better shape. You can't have healthy skin if you're, obese and your diet is just terrible. It's
Mm.
impossible, because your skin is an extension of what's happening on the inside of your body. And it's all connected. So I totally disagree with some of my colleagues. So I do, part of my practice is nutritional counseling, supplementation, skincare, some anti-aging stuff, and all of that holistically gives you the best opportunity to look your best and live your best life.
Mm. See?
Gary, can I ask you about feet? Um, the one thing I notice is that sometimes my feet will be really dry and the skin, and I'm thinking, well, then I'll put like creams on it. Doesn't really do anything. And then other times they're fine, and I haven't really figured out what it is. Is it my activity? If I do more running, are there some things that you can shed some light on there in terms of like just the skin on the bottom of my feet?
So, I mean, some of it is mechanical, right? So if you're on your feet all day, you wear shoes that maybe are not the best, fitted shoes for you, or you're going barefoot and the skin dries out, for sure you're going to have more dry skin. Some of it is weather related. So if it's summer, in the Northeast, when it's hot and humid, you're less likely to have dry skin, although it's still possible. And then sometimes dry skin is, fungus can be mistaken for dry skin. Sometimes it's a fungal infection, which is very common, athlete's foot. So if it's something that's not getting better and you've tried different moisturizers, you're drinking plenty of water, you're taking good care of your skin otherwise, a visit to your doctor to make sure that it's not a fungal infection is something else that is probably useful.
Okay.
Should your skincare, I mean, this is, obviously I don't have the answer to this, but your skin is your skin, right? Like whether it's the skin on my arm or the skin on my face, naturally the skin on my face may get more exposure to, sunlight, et cetera. But why would the protocol be any different? Like why not, cleanse the body every day, and why not moisturize with SPF, and then why not use that retinol on your body? Is it a cost thing? Is it just the fact that the skin on our body doesn't have that much exposure to with the winds and the and the climate change and the sunlight? Is that why, or is there an actual real difference?
Well, your skin is different in different parts of your body, right? So the skin on your hands or feet is naturally thicker
Right.
than it is on your arms, let's say, or your face or your neck. So there are some differences that are geographical, but in reality, you are correct, right? So we should, just like you're washing your face, you should be washing your body. Just like you're moisturizing your face, you should be moisturizing your body. You may want to use a different product. You may want to use something that has more grease than something that like a facial moisturizer, because you're not going to get acne on the back of your arms, or less likely to get it than you are on your face if you're putting grease on your face, right? So there are some differences there. As far as retinol, I have lots of patients that use retinol on sun exposed skin. So on the neck, on the V of the chest, on the backs of the hands, those are all skin areas that are exposed to the elements all the time, as opposed to like your back if you live in the Northeast, because right now you're not going out, without your shirt on. So you're correct if you're going to take care of your skin holistically, you should get something for your body as well, and treat it in the same way as you would the skin on your face. You just need moisturizer in a different quantity, right? Because it's a larger area that you're going to be covering.
Interesting. Dave?
Yeah, this is I mean, this has been very useful for me. My wife's going to want to watch this, and this will be great information for her now. And now it's a matter of coming up with a plan, like you said, and even going out and doing a little shopping trip and finding the right things. Is that, I mean, obviously you do this with a lot of your patients, and you just get them organized and on a schedule. Is that a big thing, the planning part?
Yeah, I mean, I think just writing down a list of things, or patients walking out with the right products, they can start using it right away, is a great idea. And for me, I think that the human psychology is that, I'll make you a recommendation, and if you don't start doing it within the next few days, it's very unlikely that you're going to start doing it within the next few weeks, right? You either, kind of strike where the iron is hot, or you just, people kind of fall off the wagon. So I think from that perspective, getting somebody organized, making recommendations, and then, keeping them honest, following up, are you doing this? Are you doing that? And from that perspective is important. And this is just a part of that sort of anti-aging routine, right? Don was asking me about, the little lines around his eyes. Well, 25% of cosmetic procedures in US are now men, right? Men are getting Botox, they're getting filler, they're getting laser. Hair care is huge. As we get older, our hair tends to thin out. So I think that skincare is just like a first step in that routine, right? Once you get somebody organized and say, okay, I'm going to use all these products. Well, now it's like, okay, well, I'm noticing that my face is not my jawline is not as sharp as it used to be. What's happening there? Well, we can do some skin tightening that's non-invasive. We can put some filler, we can put some Botox, we can do some laser, and still make someone, look like they did or they do, just a little bit enhanced. And I think that's part of that kind of holistic routine, but it all starts with skincare. Because if you don't have good skincare, everything else, no matter what else you're doing, it's not going to make you look as good as you can.
Well, actually, I'm going to close on this one cool thing, Derek, that Dr. Gary and I were actually speaking about. Is I'm going to come in one day with my cameraman, and he's going to take me through a procedure where he's going to actually assess my skin all over, let me know about, moles, et cetera. We're going to kind of document it, but I think it is really important to see that procedure. I'll end up picking up whatever skincare products he recommends me to do. And then it's like assigning a protocol at that point. And I think this is something that's really important. I mean, we're always talking about, how to lose fat, how to burn muscle, but the skin, I mean, that's like, we don't talk enough about this. I think this is probably one of the most underlooked areas, especially in men. I feel like women are way ahead of the game when it comes to this stuff. I mean, my wife has her protocols and she goes through it and she looks fantastic, but I almost feel like we need to be starting this a lot earlier. Like if you knew when you were 20 and you were able to start with this routine, like you're going to be better off as you get older. So Dr. Gary, I'd love, I spoke to my cameraman. I'm going to shoot you a message right after the new year. We could probably come in with those first 2 weeks if you're cool with that. And
yeah, that sounds great.
We can kind of inform everyone and educate them. And I think right now, this podcast will hopefully be up, around the new year, but could you let everyone know where they can kind of check your website out, find you on social media, et cetera?
Sure. So website is goldenbergdermatology.com. And our handle on Instagram is @goldenbergderm.
Perfect. And if anyone's got any questions that you want me to ask Dr. Gary when I'm in there, fire them off on this, Derek. I'm sure we'll be able to get this up by the new year. And Dr. Gary, have a happy holidays and have a happy new year. And I'll see you after.
Thank you. Happy holidays to you guys. Thanks so much.
Thanks, Steve. Thanks.
Thanks for the info.